Hi, this video is the art of hair transplant restoration surgery result. 1 year post-out with before and after photo by Dr. Diep. And this client had an FUE done by me a year ago, and we did 3,000 grafts, and 3,053 grafts to be exact. And we filled mostly in the frontal area and then some in the crown area. He actually had a procedure done before somewhere else, and that procedure he went to someone who not specialized in the FUE, and I have some device to remove it, not the surgeon himself. When you do that, that's when the FUE are not being harvested correctly. If you're not a FUE specialist, then the graft tend not to be very healthy, and then the density is not the same. His result was poor density, and there's no artistic and aesthetic detail, and so then the hairline didn't look natural. And on top of it, it has a little tiny mini plugs. It's very subtle, but it's there. So for me, what I did is I rebuilt his hairline, filled in the frontal area, and rebuilt his hairline and brought in the temple as well. But if we didn't bring his temple, he's gonna have a really wide forehead. As you know, I'm one of the few surgeons who focus heavily on the artistry of the hairline. Not just the hairline artistry, of course, the density as well. And with the FUE, I'm the one who personally and manually harvesting it one at a time. And those harvesting take around 6 to 8 hours, so it's a lot of work. And that's why the price is a little bit more expensive than the strip method. But I'm going to show the audience what he looked like before. And he actually himself is a physician, and he managed to have some free time to come by my clinic for a follow-up. It's only 10 months. And what he reported to me was that he had the result very good growth by 3 months. It's pretty rare. I mean, 95% take a year time, but for his is 3 months, and he had good result. And I believe that he was using A-cell on that day as well. And what I found out that most clients using A-cell, they tend to have result a little bit faster. So this is before. This is a year later, and you can see it's a big difference. And that's before, and that's with one procedure done somewhere else. And this is a year later. And this one was FUE done around 3,053 grafts, and it's manually harvested by me one at a time. And when the surgeon who are FUE specialist, he or she will be manually pulling the hair graft one at a time. And with that, you tend to have more healthier roots. And with the most healthier roots, then you have density. And if the surgeon cannot do it, then they will rely on some other machine, and then the graft might not come out as healthy, and then that's why you don't have the density. So that's before. And again, we lower the hairline, we brought the temple, and that's the poor density as well on top, you can see. And you can see how nice his hairline is, and we brought in the temple as well. Again, we brought in the temple and full density on this side. So again, we lower the hairline and fill it in, and look at that, how nice it is. And again, he's because he had a good result from my work, and that's why he allowed me to show the video. But again, he was the patient himself. Actually, he was the like many other audience, I actually watch a lot of my video, and very impressed, but then sometimes being skeptical because I want to know is it real or not. And he himself now a believer because the result is on his head right now, and and that was the good part. And again, he's thinning all the way here too as well, and we feel all that. Okay, if you can look up for me. Perfect. And you can see this is real hair. You can cut it, you can perm it, you can dye it. And you can tilt this way a little bit from here. There we go, perfect. And you can see how I rebuild his hairlines, nice density, nice zigzag as well. And that's that. Okay. If you can turn your head to the left for me. Perfect. Turn to the right. Perfect. Go ahead, look straight at me and look down. That was his head. Okay, look straight at me. And this is the art of hair transplant restoration surgery result for 1 year post-op with before and after photo. And Doc, thank you for allowing me to show the video, and thank you.